This is chapter 17, recording number 2. So we're talking about strokes. There are two main types of strokes. So there's ischemic and there's hemorrhagic. An ischemic stroke is when the blood flow through the cerebral arteries is blocked. The most common by far out of the two types of stroke, this accounts for more than 80%. So blood ends up being stopped to a particular part of the brain, generally because of a blood clot. And symptoms range depending on where in the brain is affected. So it can be nothing at all to complete paralysis. Atherosclerosis in your blood vessels is often the cause. So you have calcium and cholesterol that build up. They form a plaque inside the wall of the blood vessel, and then the plaque ends up interfering with the blood flow through that vessel. And then it also can interfere with the vessel's ability to dilate to allow more blood to come through. Eventually, that's going to cause an occlusion of the artery itself. Even if the blockage in a carotid artery is not complete, smaller pieces of the clot may end up breaking and traveling further into the brain and then become lodged in a smaller vessel. So you may even get clots from other portions of your heart or other portions of your body, It could come from your heart, can come from having DVTs, deep vein thrombosis, from your legs, and they just keep traveling until they find the point where they get lodged. So you can see that here on the representation up on your screen. Hemorrhagic strokes only account for approximately 13%, and this results from bleeding within the brain. Your blood ends up forming a clot when it bleeds into the brain tissue, and that ends up impeding the brain tissue around it. And the compression ends up affecting those cells by not allowing them to get the oxygen that they need. Cerebral hemorrhages are often fatal. There are some risk factors for people that include high stress, exertion, very high blood pressure, long-term elevated blood pressure that's not well controlled. Those people that have high blood pressure, especially, their blood vessels start to weaken over time because it just gets tired from taking a beating all the time. And then a vessel will rupture. Your cranium only allows for so much room, and it's all pretty much full as we start because every space ends up having cerebral spinal fluid in it. So it can accommodate a little bit of a change in the amount of liquid that's in the brain, but it can't take a whole lot. So when you start getting that bleed, now all of a sudden you're introducing extra fluid that wasn't there before, and you're building up pressure. And the more blood that escapes into the brain itself, the more pressure there is on the brain. And eventually the pressure has to go somewhere. You have a couple of different spots where it can go. The worst of all is coming out through the foramen magnum, where it actually pushes your brain down through there. We know that in the brainstem, there's those control centers that basically keep you alive. And so those end up what's called herniating. And now you're basically dead. Berry aneurysms. Apparently there's a typo there, but this is supposed to say brain aneurysm. So an aneurysm is a swelling or enlargement in the wall of an artery that results either from some sort of defect or weakening over time of that arterial wall. What it presents as is a sudden onset of a severe headache. People often say, this is the worst headache I've ever had in my life. Surgical repair is typically what is going to save this person because the cause often a subarachnoid hemorrhage, and that just indicates the area is to which the blood is escaping, um, are often the cause of severe, very quick increase in intracranial pressure. And then that leads to that herniation that I was talking about. TIA is also known as transient ischemic attacks. This is when it looks like the patient is having a stroke. However, the symptoms end up resolving on their own in less than 24 hours. This can be when the brain gets obstructed due to atherosclerosis or a very small blood clot that ends up getting dissolved or the body takes care of it. Some patients call these mini strokes, but it actually doesn't cause long-term damage because no actual tissue dies when you have a TIA. It's really hard for us in the field to differentiate between a stroke and a TIA. So until proven otherwise, patients are having a stroke. The hospital can figure out if that's a true stroke or not later. Although most patients really do well with their TIAs and they come out of it just fine, we still treat it as an emergency because it can be a significant warning sign that you are going to have a stroke in the near future. 1/3 of the patients who actually have a TIA experience a stroke shortly thereafter. So they all should be evaluated by a physician to make sure that they're not at risk for that impending stroke. Signs and symptoms of stroke. There are general signs and symptoms that we do include in the majority of the strokes. So facial drooping, this is due to loss of nerve innervation of an area of the face. It's typically one side or the other. You generally don't have full facial drooping. Sudden weakness or numbness in the face, arm, legs, or one side of the body. Decreased or absent movement or sensation on one side of the body, lack of muscle coordination, loss of balance, sudden vision loss in one eye, or blurred or double vision in the same eye, difficulty swallowing, decreased level of responsiveness, speech disorders, aphasia, which is the difficulty expressing thoughts or inability to use the right words. That's expressive aphasia. And then when patients have a difficulty understanding words, that's called receptive aphasia. Slurred speech, sudden severe headache, confusion, dizziness, weakness, combativeness, restlessness, tongue deviation, again, because of that loss of nerve intervention on one side of the face. If you ask them to stick out their tongue, the tongue is innervated half by one nerve, the other half by the other, essentially, in very common or very simple terms. So when they stick their tongue out, it should stick straight out. If it does not and it deviates to one side or the other, it's going to deviate away from the affected side. So that's a really quick way that we can say, hey, can you go ahead and stick your tongue out for me? If they can stick it out and it's straight, generally not too worried about it. If they stick it out and it deviates to one side, a little more concerning. Patients can also go into coma because of a stroke. So how they're affected is going to be determined by where that stroke is within the brain. So when we're talking about the left hemisphere, so that left side of the brain, stroke in the left cerebral hemisphere can cause aphasia because there's an area in the brain right there in that left cerebral hemisphere that deals specifically with the ability to produce and understand speech. So speech problems can vary widely depending on where it goes, but that's pretty indicative of a left hemisphere type cerebral stroke if there's problems with either the ability to produce or understand speech. Strokes that affect the left side of the brain, remember, will cause paralysis on the right side because your brain controls the opposite side of the body. So if we happen in the right hemisphere, you end up getting paralysis to the left side of the body. And usually what happens here, patients can understand language and can speak, but their words might be slurred, they might be hard to understand, their ability to actually intonate and use their mouth appropriately to form comprehensible speech is often going to be inhibited. Patients may also be oblivious to their problem. So because their brain is working properly to interpret and form the speech cognitively, they may have no idea that their body is not working the way that it's supposed to because they're not getting signals back from that portion. The symptom of that is called neglect. Now, it's not when somebody doesn't take care of you. This is just they have no idea what's going on. Patients with problems that affect the back part of the cerebrum may neglect certain parts of their vision. They can interpret what they're seeing, but they may have no idea that they can't see. Your brain is really good at filling in the gaps. We actually don't truly visually see 100% of what we perceive. Your brain will actually kind of fill in the gaps, which is pretty cool. Neglect and not really realizing that they have a problem can actually cause patients to not seek help. It's generally somebody else realizes that there's something wrong with them and is like, okay, we have to do something. So they can have stroke-like symptoms for quite some time before they actually are brought to definitive care. Bleeding in the brain, we already talked about a little bit. This may cause patients to have some symptoms. Blood pressure tends to be involved by one way or another. It may be the cause of the bleeding, or it may be the cause because by the bleeding, because of a compensatory response. It's kind of hard to tell sometimes with pre-hospital medicine out in the field, which one came first, the chicken or the egg. And so we just take that sign of increased blood pressure as something's not right. We definitely watch for trending with blood pressure, because if the blood pressure is high, 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 and then starts to drop, that is not a great sign for the patient. That's generally a very ominous sign when your patient has severe high blood pressure and then it starts to significantly drop without any intervention on your own. A patient that's anxious is going to have high blood pressure, but not like super high, not clinically significant type high blood pressure. And when it drops because they're worsening, it tends to drop pretty quickly, unfortunately. There's other conditions that may mimic a stroke, and so we have to be very vigilant. Hypoglycemia, if your brain doesn't have blood glucose or doesn't have glucose in the blood, it does not function, similar to not having enough oxygen. So on anybody that's exhibiting stroke-like symptoms or an altered mental status, we should check a blood sugar just to make sure. If a patient has recently experienced a seizure and they're in what's called the post-ictal state, this can last between 5 to 30 minutes after a stroke or after a seizure. We need to double check that they did not have a seizure, and sometimes it's really hard to tell that. If they have a subdural or epidural bleed, you have a collection of blood that's really near the skull that presses on the brain. There's not an issue within the blood flow of the brain itself. It's just the pressure that is making that difficult. We'll stop here.